losing an erection quickly during intimacy. It's more common than many admit, but it's not just embarrassment, it can point to underlying health or lifestyle issues. In this video, we'll explore the main reasons men lose their erection too fast and practical, natural strategies you can try to improve it over time. To understand why erections fail, you need a quick refresher on how they work. An erection occurs when blood flows into the penile tissues and gets trapped there by compressed veins. That requires a healthy circulatory system, nerve signals from the brain and spinal cord, and proper hormonal signals. If any part of the system falters, the erection can fade prematurely. Here are 11 reasons. Some you can't control, others you can work on. Atherosclerosis, high blood pressure, high cholesterol, all narrow arteries, making it harder for blood to flow into the penis. Venous leak, also called venogenic ED. The veins let blood out too quickly, so you can start an erection but can't sustain it. Damage to nerves from surgery, spinal injury, neurological disease interrupts the signals needed to maintain erection. Low testosterone or other hormone issues may weaken erection strength, libido, and consistency. Performance anxiety, stress, guilt, depression. The mind can override physical signals, interrupting erection maintenance. Situational pressure or overthinking mid-act is a common trigger. Alcohol, smoking, drug use impair vascular and neurological health. Obesity, metabolic syndrome, diabetes, these harm blood vessels and nerves. Medications for blood pressure, depression, etc. sometimes have side effects that affect erections. Age, chakshacha, natural decline. As men get older, changes in vascular function, hormone levels, and general health increase the chance of erection failures. Excess pressure/trauma to the pelvic area, tight clothes, cycling, prolonged sitting may compress nerves or vessels. While medical causes may require medical interventions, many natural strategies help improve erection sustainability, especially when the cause is mixed or early. Here are steps you can take. Improve vascular health. Do regular aerobic and strength exercise to support circulation and endothelial vessel lining function. Eat a heart-healthy diet rich in vegetables, lean protein, healthy fats, and fiber. Minimize saturated fat. Manage stress and psychological aspects. Practice mindfulness, breathing exercises, mental de-arousal techniques. Consider counseling or sex therapy if performance anxiety dominates. Optimize hormonal balance and general health. Maintain healthy weight. Ensure quality sleep. Poor sleep correlates with lower testosterone and worse erections. Review medications with your doctor. Some may be adjusted. Limit harmful habits. Quit smoking, reduce heavy drinking or recreational drugs. Reduce exposure to hormone-disrupting chemicals. Avoid tight clothing or long periods of pressure on the groin, cycling, etc. Pace stimulation and manage technique during sex. Ensure adequate foreplay, maintain arousal. If erection starts to decline, slow down or shift focus rather than push through. Communication with partner can reduce performance pressure. Consider supplements cautiously. Some supplements, L-arginine, ginseng, PDE5 boosters, show promise but only use under medical supervision. Never rely solely on supplements for significant or persistent problems. These habits aren't overnight fixes, but with consistent application, many men see improvement in weeks to months. If erection loss becomes frequent, worsening over time, or causes distress, don't wait. It's wise to see a healthcare provider or urologist. They'll run assessments like vascular tests, hormone panels, neurological exams to pinpoint the root cause. Natural strategies can help in many cases, especially early or mixed causes, but they aren't guaranteed solutions for all. Use them as your foundation, monitor progress, and pair with medical guidance where needed. If you found this video helpful, hit like, subscribe, and comment which strategy you'll try first.